name is Rebecca Farrar. I am a student at Auburn University's Nurse Practitioner program. For the purpose of this video, we're going to be completing a head-to-toe assessment on my patient. For the purpose of this video, we will be doing things unilaterally and verbalizing the things that we would be doing bilaterally. Before I come in, I would have washed my hands, and then I will be assessing my patient, Cody. We will start with visualizing the general appearance of the patient. When I first talk to him, I'll be checking his cognition, see if he's alert oriented, if he's able to answer questions appropriately. Also, we'll assess his gait as he enters into the room, look for any signs of obvious distress. And then I will assess his vital signs, his blood pressure, his heart rate, respiratory rate, oxygen saturation, temperature, and ask about any pain. If he has any pain, we would address that individually. We also would check his height and weight. And then once we've done that, we're going to move to the head-to-toe assessment. So the first thing I would start with is with the head. I would first inspect the hair, the scalp, looking for texture, even distribution, the texture and color of the hair, making sure there's not any patchy areas, missing hair. I would then palpate the head, ask if there's any tenderness, note any swelling. I'm also checking for symmetry. Okay. Do you have any tenderness?
No.
Okay. From there, we're going to move on to the sinuses. I'm going to palpate the maxillary sinuses and ask if there's any tenderness. Any tenderness noted?
No.
Okay. And the frontal sinuses as well. Okay. After that, we're going to assess the eyes. And we're going to be looking at several different things for the eyes. The first thing we're going to do, we're going to look at the external eye, the eyebrows, make sure that they're evenly distributed, the hair, note the texture and the color. Also going to be looking at the eyelashes, the inner canthus and outer canthus of his eyes, as well as the pupils and the sclera. I'm going to pull his eyes down to check for his conjunctiva, and noting that they are pink and moist bilaterally. The next thing that I'm going to do is I'm going to check for a corneal light reflex. I'm going to shine the pen light in the middle of his eye, asking him to look beyond me, and I'm looking to see if there is an equal light in both eyes. Very good, and there is. The next thing I'm going to do is I'm going to check to see if his pupils are equal, round, and reactive to light and accommodation. So I'm going to shine the light in one eye and see if the other pupil accommodates with it. So both eyes were equal, reactive, and accommodated to light. The next thing that I'm going to do is I'm going to get you to cover one eye, and then uncover, and then cover the other eye, and then uncover. Very good. I'm looking for any lateralization or any abnormal eye movements. The next thing that I'm going to do is I'm going to have you stand up for me. Cover your right eye. And let me know when you see my fingers wiggling.
Yeah. Yep. Yes. Yes.
Good job. Okay. After that, I'm going to do the other eye.
Yep. Yes. Yes. Yes.
Very good. All right. I'll have you sit down for now. We would get a Snellen chart and place it 20 feet away from the patient, have them read from the lowest line that they can read, covering one eye at a time to determine the visual acuity. Let's see. After that, we're going to move into, I'm going to use the ophthalmoscope. I'm going to shine this into the eye looking for the back of the retina. Okay, and I would do this bilaterally, trying to visualize the optic disc, the optic nerves, looking for any lesions or hemorrhaging, and there were none noted. Okay. Next, I'm going to move into the ears. I'm just doing a visual inspection of the outer pinna and tragus. I'm going to palpate them. Do you have any tenderness?
No.
Okay. Looking for any lumps or lesions or any pain. I'm going to move to the inner ear. And then move to we start with the middle ear and then move to the inner ear. In the middle ear, we're looking for any redness, swelling, the cerumen, the color, consistency. Then as we move to the inner ear, looking to visualize the tympanic membrane, visualizing if there's any air bubbles, drainage, fluid, and then also identifying landmarks such as the malleus. We do this bilaterally as well. After this, I'm going to inspect the nose. First, I'm just going to look at the outer appearance, and then I'm going to look inside the nares. And I'm looking for, good job. Looking for any drainage, swelling, septal deviation. I'm also going to have him inhale while closing the other nose to inspect near patency. Now I'm going to get you to open your mouth and say ah.
Ah.
Very good. I'm visualizing the mucous membrane. Lift your tongue up. Underneath the tongue, the dentition is intact. And then I'm looking at the gums. Everything is pink and moist, no lesions. Okay? And then the uvula is midline. Okay. Next, I'm going to move to the neck inspection. I'm going to be assessing the lymph nodes. I'm going to do periocular, pre-auricular, post-auricular, occipital, parotid, tonsillar, submandibular, and submental. And then I would move to the anterior cervical, both posterior cervical chains, and then the supraclavicular. And as I'm assessing the lymph nodes, I'm assessing for swelling, tenderness, any bulging, things like that. The next thing I'm going to do is I'm going to look at his trachea to see that it is midline, looking for any deviations, tenderness, and then I'm going to come around to behind him to assess his thyroid gland. I'm going to locate the Adam's apple and ask him to swallow. Very good. I'm checking for any tenderness, masses, lesions, anything like that. Any swelling noted. While I'm here and have him sitting, I'm going to get him to do some range of motions with his neck. So we place your chin to your chest. Very good. And then take your chin and place it to each shoulder. Very good. And then take each ear and go to each shoulder. Very good. Okay. Also, while you're here, I'm going to get you to shrug your shoulders for me. Good job. Okay. The next thing that I'm going to do is I'm going to move into the respiratory system. I'm going to start with the posterior portion of the respiratory system. And for this evaluation, I'm going to have him remove his shirt at this time and turn just a little bit. There you go. Okay. First, I'm going to start with inspection. I'm assessing the integumentary system as well as looking for any abnormalities with the spine, with his back, chest, and then I'm going to palpate for any tenderness, any masses, meanwhile checking for any hair distribution, any tenderness. Okay. I'm also going to check for symmetry as he takes a deep breath in, placing both hands on his back. Very good. I'm also going to do some tactile fremitus. Can you please say 99 for me?
99.
Very good.
99. 99.
More?
99.
Very good. Okay, next I'm going to percuss, moving from one side to the other and then moving down in a zigzag, listening for any dullness, hyperresonance, very good. Lastly, I'm going for the respiratory system in the posterior region. I'm going to listen both with the diaphragm and the bell. Okay. As I place the stethoscope, just take a deep breath in and out. Very good. Very good. I'm going to flip over to the bell. Deep breath. More time. Very good. As I'm listening, I'm ensuring that I'm going from one side to the other to compare sounds, and then also listening for any adventitious breath sounds such as crackles, wheezing, things like that. I'm going to move to the anterior portion of the respiratory system. I'm going to inspect the chest wall for any for symmetry, any abnormalities. I'm going to feel for any lumps, bumps, lesions, things like that. And then I'm going to auscultate breath sounds. Okay, deep breath in. Okay. More. Again. Very good. Okay. From there, I'm going to move to the cardiovascular system. A part of the cardiovascular system is to assess the peripheral vascular system. I'm going to start with all of the pulses and then move to skin turgor, and then that also will cross over with some of our integumentary. So the first is we're going to palpate the temporal pulses. We want to see how strong they are, if they're consistent, if they're comparable to each other, and also how the grade that they are. And we'll move to the carotid, doing one at a time. Okay. Very good. And then move down to the brachial. I'm also going to do this bilaterally. While I'm doing this, I'm going to feel for the temperature of the skin, check the skin turgor for any tinting, dehydration, the coloration of the skin as well. Then I'm going to inspect the nails. It says capillary refill. Very good. I'm also going to look for any dryness, cracking of the skin. I'm going to move down and do the radial. And also the radial and ulnar on this side. Okay. I'm going to do the popliteal, palpate it bilaterally. Do this leg real quick. Thank you. Okay, and while I'm looking at the legs and palpating the pulses, I'm checking for any swelling, edema, any lesions, lumps, anything like that on the skin of the legs. I'm also going to be feeling for the temperature. Okay, I'm going to ask you to take off this sock real quick. I'm going to locate the dorsalis pedis and the posterior tibialis. I'm also going to be checking capillary refill, and I would do this bilaterally. I'm going to take this one off too. And capillary refill, everything looks good. Okay, I'm going to have you, before you lay down, I'm going to listen to your cardiovascular system. I'm listening with both the bell and the diaphragm. I'm going to listen first in the aortic. Pulmonic. Herb's point. Tricuspid region. And the mitral region. Good. I'm going to listen with the bell as well. I'm listening for a clear S1, S2, listening for any split sounds or abnormal heart rate rhythm. I'm also going to be palpating for the point of maximal impulse. Very good. Okay, now I'm going to have him lie down. As I get him to lie down with the bed at 45 degrees, I'm going to be assessing for any jugular vein distension or swelling or bulging. Okay. And there is none noted. I'm I'm also going to listen to his cardiovascular system while he is lying down. Very good. And also listen with the bell. Okay. Since I have him lying down and our shirt is off, we are going to do a breast exam. So we're going to first inspect the breast for symmetry, hair growth, assess the nipples for any dimpling, discoloration, any discharge. Also would provide education on the importance of doing self-breast exams. I would also palpate the axillary region for any lymph nodes, swelling, masses, things like that. And then we're going to work with each breast, working from the outer and in to the nipple in a circular motion, feeling for any masses, lumps, or tenderness. You feel any tenderness? Good. I'm going to do this bilaterally. Now I'm going to move to the abdominal inspection. So we're first going to inspect the abdomen, looking for symmetry. Is the umbilicus midline? I would also ensure that the patient has voided before this assessment, as I will be pressing on his abdomen in a few moments. We're going to inspect, and then next we're going to auscultate so that we are not pressing on the stomach to mess up the bowel sounds. Okay. I'm going to listen with both the diaphragm and the bell. I'm going to listen in the epigastric region as well. Okay. Also going to listen with the bell. And auscultate the abdominal aorta. Okay. Once we've noted his bowel sounds, if they're active, hyperactive, or hypoactive, we're going to move to some percussion. As we percuss through each area, there are going to be some areas that are more dull, and that's typically over the liver and the spleen in the right upper quadrant and left upper quadrant. I'm also going to percuss on the sides, and then I'm going to move with light palpation to deep palpation, feeling for any masses, asking for tenderness, noticing any abnormalities. We would like the spleen and liver to be non-palpable. Do you have any tenderness? Okay. Then I'll move into some deep palpation. Okay. Any tenderness, pain? I'm also going to check for rebound tenderness, which is commonly associated with appendicitis. I'm going to press down and then ask if there's any pain when I release. Very good. For the purposes of this exam, we're not going to do the genital and inguinal assessment without our clothes on, but we will discuss it. So for the male, we would be assessing the penis, the testes, the scrotal sac, where we're going to inspect and look for any obvious lesions, discharge, discoloration. Also going to feel, palpate the testes to see if there's any lumps or bumps or anything abnormal. If the male is uncircumcised, we would retract the foreskin, locate the urinal meatus, ensure that it is in an appropriate location. And then upon finishing, we would replace the foreskin. Something else that we would do is we would also palpate in the inguinal area and have the patient turn their head the opposite way and cough. Very good. Another side. And that is to assess for any hernias, inguinal hernias, things like So from there, while I have him laying down, I'm going to do some range of motion. Okay, I'm going to have you lift your leg up, bend your knee. I'm going to check the joints for any crepitus, cracking, popping. Also going to lift it one more time. Move your hip in and out. Very good. Careful to support the joints while we're doing this. Jump this leg and straighten. Very good. And then in. Hip. Very good. And down. Also going to have you flex your feet, point your toes. Very good. While I have him down here, I'm going to check the Babinski reflex. Checking to see if our toes fan out, which would be an abnormal sign. And while I have him lying flat, I'm also going to check the abdominal reflex. Very good. Okay. Now I'm going to have you move to the end of the bed. Okay. And stand up for me. We're going to do some range of motion. Will you lift your arms to the side? And try to, let me push them up. Good job. All right, now do the opposite. Now flap, like this. Very good. I'm going to have you bend your elbows in and out. Very good. Down. We already did the range of motion with the neck. And then I'm going to get you to, I'm going to check balance. If you'll walk heel to toe forward for me. Very good. And back. And hop on one foot. Good, the other one. And hop on both feet. Very good. All right, and now I'm going to have you turn towards me. We're going to check some of his balance and coordination with the Romberg test. All right, and then I'm going to have you balance on one leg. Close your eyes. Very good. Okay, and then have a seat for me. I'm going to have you take your finger and touch my finger and go back and forth to your nose. Very good. And the other one. Very good. Okay. One thing I do know that we left out from the hearing is our auditory. So I'm going to assess with the Weber and Rhine test. So I'm going to hit this and put it on the top of your head. I want to let you let me know which ear you hear it in, or if you hear it in both equally. Okay. In both or one? Good. That's the Weber test. I'm going to do the Rhine test bilaterally. I'm going to hit it and place it on your bone back here. Let me know when you don't hear it any longer.
All right.
Okay. You hear it now? Mm-hmm. Very good. So our ear conduction was greater than bone conduction, and that's with the Rhine test. I'm also going to check with the whisper test. So I'm going to stand behind you on this side. And I want you to repeat after me.
BCA.
Very good. Now come to the other side.
DEG.
Very good. Okay, so now we're going to go through some of the cranial nerves and make sure that we have assessed them all. So first, for cranial nerve 1, I'm going to assess our olfactory, our sense of smell. I'm going to include one side of the nose and tell me if you smell the alcohol. Okay, and the other side. Very good. All right, with cranial nerve 2, we assessed our visual acuity with a Snellen chart. With cranial nerve 3, 4, and 6, we assessed pupillary reaction and then our extraocular movements. For cranial nerve 5, I'm going to have you clench your teeth. Very good. I'm also going to have you... we also checked the corneal light reflex. I'm going to assess your mastoid muscles. Clench. Can you open and close your jaw for me? Very good. I'm also feeling the temporal mandibular joint. Okay, no clicking noted. For cranial nerve 7, I'm going to have you raise your eyebrows. Very good. Smile. Frown. Show your teeth. Puff your cheeks. All right, I'm also going to alternate between something soft and something sharp or dull. So will you close your eyes for me and tell me what you feel?
Soft. Soft. Sharp. Soft.
Okay. For cranial nerve 8, we did the Weber and the Rhine test. For 9 and 10, we checked the gag reflex, and you're able to swallow for me. Very good. For cranial nerve 11, we shrug our shoulders. Very good. And then for cranial nerve 12, open your mouth and stick out your tongue and move it around. Very good. All right. Thank you so much for watching.